Welcome everyone to another Canine Campus podcast. I am here with my dear friend Blair French, who has been my therapy dog evaluator. Well, you've been my only one ever since I offered therapy dog evaluations at Canine Campus. And on top of that, Blair was absolutely instrumental in helping me set up the class. She always came to the first class and ran a mock test for everyone with a certified team, because it's really helpful to see what's required to pass the test. So let's talk about that a little bit. Why do you think it is so helpful for people to see the test in action before taking it?
Well, it's one thing to be practicing with your dog, your handling exercises when you're at home or in familiar surroundings, but it's another thing to be actually taking a test, having the stress of having someone evaluating you, but also being in a new environment. And the test tries to replicate what it would be like to be in a hospital setting, which is, until a dog has been going for a long, long time, is a new environment and is always going to be doing something that will be not necessarily something you expect. Yeah.
Well, I think, we've talked in the past on past podcasts about how dogs don't generalize well, and how when you're working on a behavior, you start in a low distracting environment. And a lot of us can't replicate a hospital room
right.
or a hospital setting
and nor can I replicate it in an exam. But I can at least see how a dog handles a situation, a place where the dog has never been, and the handler, because as you know, these evaluations ideally are not just about the dog, but they're about the human-animal connection and whether both are capable of undertaking this.
I think so many people that want to do therapy work really don't understand how important the human part of that team is. Right. I mean, it is definitely a partnership, and the human's 100% responsible for the dog to begin with. But I mean, and I haven't done any therapy work. You've done tons of therapy work. You really have to have pretty good social skills. I mean, you're in these hospital settings and you're sometimes seeing some pretty upsetting things. I mean, there are some medical procedures that are uncomfortable to kind of see the results of, my bet would be.
Well, when I, for 4 or 5 years, I went once a week with my dog, my hound Mix Bell, to a children's rehabilitation center, and they specialized in head injury and spinal cord injury cases, and there was one procedure where there would be brain surgery, and the doctors would remove part of the skull temporarily, and then when the brain expanded from swelling, and then replace it when the brain stopped swelling. But when you're visiting a child, when that child is in that interim period, it's something that you never ever expect to see unless you are used to being in a hospital setting. And most therapy dog handlers are not given an orientation that includes that kind of exposure.
Yeah, I mean, you don't want to look aghast, right? But it's so hard not to be a little shocked.
Right. So again, it just you have to be the thing that I think is always important to remember is that people who want to be therapy dog handlers, there are two elements to it. One is the dog has to be well suited, and temperament, and also well trained, but the person has to be well suited too. And sometimes you have a case where the dog is great and the person is not, or the person is great and the dog is not. But what you're hoping to find is a good combination where both are well suited for the job.
So I know a lot of times people ask me, what's the difference between service dog and therapy dog? So maybe we ought to talk a little bit about the difference between those two things. So service dogs, those are dogs that are trained to help people that have disabilities.
Correct.
And therapy dogs are what?
Well, there are 2 levels of therapy dogs depending on which organization you certify with. But for the most part, therapy dogs are meant to be visitors. You're coming to the room or to the facility to offer comfort, joy, a visitation, a break in routine. You're not necessarily part of the medical procedure.
You're not part of the therapy process. Correct. Or physical therapy process, I should say.
Right.
But you can be.
You can be. There can be another level which requires another, for Delta, for instance, there's, I believe it's called animal-assisted therapy.
Yeah, AAT, I think.
Right. And the dog has to pass a test that is much more hands-on, and it has to be evaluated with that in mind.
Yes. So let's talk about the two organizations. So if anyone out there that's interested in doing some therapy work, definitely head to the websites for these organizations. The first one is the Delta Society, and they certify dogs to do therapy work, as does Therapy Dogs International. And you can Google both of those, and in the show notes I'll give you the websites. So what's important about visiting those sites too is seeing the requirements for the test. So both Delta and TDI, which is the what we call Therapy Dogs International, they incorporate the Canine Good Citizen test for the most part in their therapy dog test. So the AKC has a little certification that you can get for your dog called the Canine Good Citizen. It doesn't give you any privileges in this country if you get the Canine Good Citizen, although it's a really good resume builder, and I know there's some landlords and stuff that are actually required, so it's a good thing to get. And basically a dog is tested for 10 elements, sort of nice manners. So we can go into the details of that, but you can look it up. But basically they've got to be polite when someone comes up and talks to you and shakes your hand. They have to be able to be brushed and paws picked up and walk politely on a leash, handle walking through crowds, deal with a loud crash, supervised separation.
And meeting another dog.
Oh, right, because you're remembering the one that trips most people up. Right. Reacting to the other dog part, where you actually have to walk politely up to someone else with another dog, shake their hand, and walk on. And the two dogs can't interact or be too interested in each other. Right. And Blair remembers that one really well because that is one of the toughest parts of the test.
And it's tough because it's hard to practice. Because how many people do you know?
That's an excellent point.
Right. How many people do you know who have a dog that will stay on their side of them while you practice coming up with your dog to say hello? You have to have another well-trained dog to practice that.
I never even thought about the training challenges of that, which is a reason why a group class could be a good situation for this. So the Canine Good Citizen, those elements that we were just talking about, that's part of the therapy dog test. And then there's like this whole other part of it where equipment's brought in, being able to interact with someone in a wheelchair, crutches, walkers, loud sounds. Children, hugging, sort of rough petting because there are people that are recovering from injuries and they don't have great motor control. What about people that don't want to see your dog? I mean, you show up, you're talking about working with the kids. There's a lot of dog bite cases now that I know are showing up in hospitals. And I would imagine if I were a child and a dog ran in the corner, I would not be at all. I'd be freaked out.
Right. Well, and sometimes the child is in the hospital because of a dog attack. I mean, there's also has been that case. Myself personally as a handler, what I would always do is when you sign up, you always should ask the staff, is there anyone here who is afraid of a dog? And in the rehabilitation center I went to, there was a large turnover. So every week there were bound to be new people there. And they would
you really have to have kind of a rapport with the staff. I mean, you've got to know what's going on in that facility.
It helps. And sometimes the staff, you can have a staff member who's also afraid. And so you'll have to try and be conscious of that.
Oh, right. Didn't even think of that.
But then going door to door, before you even go into, if you're doing room-to-room visitation, you always stop at the door and say, would you mind or would you like to visit with a therapy dog? And that gives enough space so if the person is terrified, they can say, no, 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 go away. And you can usually tell almost immediately by body language, the look of fear on a child's face that they do not want to visit.
Yeah. So and I guess, I mean, I wouldn't have hurt feelings.
No, well, what I would usually do is my hound has very long ears, so I would just pick up an ear and wave it and say, okay, will we say goodbye?
Oh, I love that.
Yeah, so it becomes kind of a benign, even though you can't change
the situation.
Exactly.
Yeah, that's now, I want to talk a little bit about the testing itself because you're, as an evaluator, I've seen a lot of tests with you, but you've seen a lot more without me because you were doing this long before you and I hooked up. What do you think, I mean, if someone is considering doing therapy dog work, what would be your number one recommendation for them? And what are some of the things you think that would help them accomplish that goal?
Well, what I always tell people is that when I was evaluating, the greatest common denominator among people who did well in the test were people who'd gone through a structured obedience program. because then I knew that they had been in situations where the person's dog had to be around other dogs, a lot of distractions, knew how to train. Doesn't necessarily guarantee passing, and I passed many dogs that did not go through a formal program, but that by and large, that's almost always my first recommendation.
Is to get into a class, not necessarily a therapy dog class, but any class, so you're working in distractions and you're working around other dogs, which is going to be, an element of the test, as we discussed, the reaction to the other dog part of the test. What are some other recommendations that you would give people?
If they were interested in pursuing this, I would definitely shadow someone who is already handling a dog. And
how would you go about doing that? I mean, do you look for a local organization that sponsors therapy dogs? I mean, we have one here.
Right.
But how would the average person find that out?
Well, if you have a sense of where you want to go already, I would call that facility and say, do you have someone...
Like a local hospital.
Right.
Yeah.
But also contacting the local therapy dog associations too. Both, but I think either one would get you where you wanted to be.
And then shadowing someone, so following them around on their visits to see what it's all about.
Right, and to see, and because also you just don't know really what environment you want to do either until you see. I mean, I was like the last person who would ever consider doing children. I don't have children of my own, I don't have a lot of contact with kids. But when I went to the Children's Hospital to shadow someone, I found I had an immediate rapport with kids who were injured or sick. It was.
Wow! So you didn't even know that would be an interest for you.
That's right.
That's great. So you have let's say you accomplish your therapy dog certification. The next phase then would really be pick the right environment to do the work in. Right,
and also that is appropriate for your dog. I happen to have a dog that is less demonstrative than other dogs. So it worked. She worked very well in a setting where people were in wheelchairs, in beds. I mean, she was not a very wiggly, active dog. But there are other facilities where if I showed up with my dog, people want much more interaction, and they would say, "What's wrong? Why doesn't your dog like me?" That you want to avoid. That is not good.
So really knowing your dog, really knowing yourself, and I think shadowing is such a great way to see where you fit in, where you click.
And you also get to see the pitfalls. I mean, things that you would never in a million years. I mean, people used to ask me all the time, why is there a leave it in the evaluation? Why do you have to teach your dog on command without touching the leash to not pick up something with its mouth? And it's because in hospital situations, how many times have I seen pills on the floor? I mean, it happens, and you don't want your dog picking up something like that and eating it. It could be dangerous for the dog's health.
Yeah, I know. We also got a lot of questions about the supervised separation, where your dog is left with the evaluator for 3 minutes, and the owner leaves the room, and the dog can't essentially freak out. They can move around. They don't have to maintain a particular position. But one of the rules of therapy dog work is that you never hand your leash over to anyone. So the supervised separation was always a big question.
Well, because not only are you not allowed to hand your leash over, but your insurance will not cover anyone who is holding that leash. So so that's why
that's
never
an important point.
You never ever let anyone else handle your dog. But the reason why we have that in the evaluation is because if something were to happen to you, say you became ill, you fainted. Anything that removed you from the equation, someone has to be able to take your dog
and manage
the dog.
I think liability is such an important thing to bring up, because there are facilities that do not require certification to visit them, and I know you and I, it makes our heart stop when we hear this, because one of the great benefits of having the certification is you are covered. You have liability insurance, which is essential in the world that we live in. And when I tell people this, a lot of times they say to me, my dog would never bite someone. And one of the things I learned from you, it's a dog that accidentally puts their paw up on paper thin skin of an older person and scratches it, and you've got a little incident that aggression wasn't part of the equation. If anything, it was shake, and it missed the mark. And it's so important to have coverage, and I think that it's important for everyone to remember that's not just about aggressing.
No, and it can happen. I mean, there just can be accidents. I mean, the thing I used to tell people in the evaluations or when, in the course that you were teaching, when people would come that first day, That there was one time that I took Belle into the children's hospital, and I had to use a chair I never used before for her to hop on to get close to a bedridden patient. And Belle, it was one that had open sides, and her paw went through the side and hit the bed. Fortunately, she only hit the mattress. But that always stayed with me as an example of how, even though I was doing what I thought was a fully responsible task and one that I had been taught was acceptable, that could have caused a problem if her paw had gone through and she'd struck a limb that had just had surgery, something. I mean,
or wires and all the stuff that's attached.
It could have been a disaster.
Yeah,
but it wasn't, thank God.
Right.
But that's the kind of thing that people don't think about.
Totally innocent, actually doing exactly what the dog's supposed to do, but how can you plan for a chair?
It's an accident.
Yeah, and accidents are waiting to happen, as we know. Now, in terms of the test, what do you think is, in the vast experience that you have having tested so many people, what do you think are the biggest challenges for people in the test?
Well, I think
other than the nerves of taking a test, I don't think that can be discounted. And you brought that up earlier, where being in that testing setting, people don't talk to their dogs. They don't give the same kind of feedback. You can't use rewards in the test other than verbal and physical praise, and people get so nervous they kind of shut down and their dog gets no feedback. But just in terms of the technicalities of taking the test, which elements do you think trip people up the most?
Well, the first one that usually trips people up is the walking on the loose leash.
Loose leash walking.
And there, again, it really comes down to the skill of, if you have a well-trained dog, then you have that dog's attention. And if you have not put the time and effort into training your dog, you're not going to have your dog's attention. And if you don't have your dog's attention, you have nothing.
Right. And if you can't get it back, I think I've been with tests with you where, yes, the dog rounds a corner, there's something interesting to sniff. You're not expecting 100% attention. No. You're expecting the ability to get the attention back.
Right. A well-trained dog, yes, there's no such thing as an automaton. Every dog is going to be distracted by a scent or a sight or a sound that they haven't heard before, but it's the bounce back. It's the ability of the handler to recall the dog's attention in a pretty quick fashion.
And so one thing that I want to bring up to everyone that listened to the Loose Leash Walking podcast, with Therapy Dogs International, you can't use any training aids in the test, just a flat buckle collar. You can't even actually use a harness. But in Delta Society, you are more than welcome to use a gentle leader or an easy walk harness or a traditional harness, as long as you use it on the visits too. So if you pass with it, you've got to use it on the visit. So for those of you that think you have pretty good loose leash walking but need a little help with that, and I've got a husky and Blair knows I need a little help with that, I would not test her without a gentle leader or an easy walk harness, and that's just me. Right. So, so loose leash walking is the first one where people get tripped up.
Right.
What are some other ones?
Well, some of them are just basic obedience. This is where you see whether or not a dog just has basic obedience. And if they don't have the sit, the down, the stay, you're in trouble.
We saw that one test where the guy, remember, got down.
Right.
It was great. He clearly had not even read what the elements of the test were.
Right.
He had a good relationship with his dog, though. And when it came to down, his dog did not know down on cue. And this gentleman got down on his belly. He sort of did it. Probably took 3 minutes,
right?
But the dog finally was like, I have no idea what you're asking for, but I'll go with it. I got down too.
Right. So but the leave it, and also the meeting another dog, those are the three I'd say: the loose leash walking, the leave it, meeting another dog. Although any dog can trip up on any element. We had the one dog that wouldn't tolerate having his paw handled. That was just right off the bat. This is where you think that, you just don't expect a dog not to wish to be handled. A potential therapy dog.
You would think that to take the test, that would kind of be on
And then we
mind.
had that one dog that freaked out over wheelchairs and crutches.
Yeah.
And that is another thing too. You should try and make sure that your dog is around these pieces of medical equipment. You don't have to own one, a wheelchair or a pair of crutches, but you should certainly know where in the town you live, people are out with everything that would fit that description.
Yeah, it's the equipment needs to be a given. I mean, your dog, the test should not be the first time your dog sees a wheelchair is what I think Blair is telling us. So Leave It, I want to talk a little bit about Leave It. Leave It is a cue that you offer when you don't want your dog to put their mouth on something. And you talked about pills as an example. In the Therapy Dog International test, it's a yummy treat. It was begging strips one day when you did it, and they were smelling great. In the Delta Society test, it's a stuffed animal. But it's a good skill for any dog to have. And I think what's essential to the Leave It, and this is what you brought up, it doesn't mean that the leash jerks and gets the dog away from the element. They need to make the decision not to put it in their mouth. Mm-hmm.
And that is something you have got to train. Yeah. So this is the one skill. A person can kind of generally have good rapport with a dog and get through a lot of the test. But if a dog has not been trained to leave something, a dog will not leave it.
Yeah, especially a begging strip.
Although my little English Cocker Spaniel would not leave a toy. He'd leave food, but he would not leave a toy.
Well, there's always something that'll get him. There's always something. And then the reaction to the other dog. And usually it's friendly reaction. I mean, what we see is that it's the labs that love every dog in the world.
They're the ones that suffer the most.
Wants to go visit their pal. And so it's usually not ugly reaction. But I will say the dogs that have... I know people that have dogs that are kind of snarky to other dogs on leash, have some elements of on leash aggression, who still pass the therapy dog test, because you can actually pick your times to make sure there's no other dogs around.
But it is important. Where I went, there were no other dogs visiting at the time that I would visit, but still it was an important skill to have, because there was one time I went into a patient's room and the patient was blind, and the patient had a seeing eye dog.
Oh, surprise.
Right. And that is why I had to retire my dog, Belle, because she stopped being nice to other dogs. And it was just in the neighborhood. But it's still something that...
That's something I would have never thought of. Mm-hmm. Never thought of. And, speaking of retirement,
yes.
With Delta Society, you have to recertify every 2 years.
Yes.
So every 2 years, there's fresh eyes on your dog to see how the team's doing. With Therapy Dogs International, it's kind of the honor system.
Yes.
How do you come to the point where you feel like it's time to retire your dog? That must have been hard. You really enjoyed the therapy work that you were doing with Belle.
I loved what I did with Belle, and it turns out the dog that I got to replace her is not capable of doing for medical reasons. So I'm really out of the game for the moment.
But he's capable of being the cutest thing alive.
So it's been very sad for me not to be going on visitations. But with Belle, it was yes. I think that mandatory testing is the best way to go, because people are so much in denial over their own dogs, and it's very difficult to admit to yourself that you have a problem with your dog that is going to remove you from something that you love doing. Mm-hmm. In my case, I'm just someone who can't live with, as an evaluator especially.
Yeah.
I just, when I started seeing the aggression in Belle on leash in the neighborhood, and I worked with you, I knew that I was able to change her response, but I knew that the aggression was still basically there.
The discomfort was still there.
Right,
she just displayed it differently.
Right. So in my case, I think I pulled her at just the right time. Mm-hmm. But I think it should not be left up to the handler to decide that.
Because you and I have seen a number of cases where it was just too hard for them to really see that their dog, that wasn't the best situation for their dog.
Right.
I have a lot of people that come to me with puppies and say, my goal is that my puppy is a therapy dog. And it's a lovely goal, and communities definitely need more therapy dog partners. And I always encourage people, because I think it's a great goal, but it's really hard to determine of a little puppy. You don't know who they're going to be, and their socialization experiences so change their personality.
Right.
And there are some lovely, lovely dogs that aren't necessarily fit for therapy work.
Right.
And it's not a judgment about that dog.
Right.
But
I do think too that even within an organization like Delta that has the recertification, is it every 2 years? Mm-hmm. Even then, it still has to be up to the handler in part. Because the test can only take a snapshot of a dog.
It's a moment in time.
A moment in time, and so. You have to always keep in mind what it is you are there to do. And it's not, the number one priority is not to have a great time with your dog. The number one priority is to bring comfort, joy, some break in a horrible routine to people who don't have that option, or I mean, this to them, it's for the other person. It's not really all about you and your dog. And so when you start putting your own interests first, that's when you really are, you're not in it for the right reasons.
Yeah, and I think it's, you tested Silly, which is one of my doggies, and he passed the test. And I think part of the reason why he passed the test is he's been the reaction to the other dog in the test for a long time. And so he's pretty familiar with it.
That's a big paw up.
He's pretty used to it. But even with the certification, I knew that Silly is kind of got a shyer temperament, and he's gotten much braver in recent years. He really has. It's something that we've worked on a lot. But I could not envision him being comfortable in a lot of settings, and so I didn't put him in this situation. I mean, I ended up not visiting with him, and as a dog trainer, I have a certain amount of pressure on me to have certification on my dogs, and if you're training other people, how well have you trained your dogs? And it would be great to say, well, I have a certified therapy dog, and my dog does therapy work. Well, he doesn't. He got the certification, but
at least you got the certification hoping that you could go in and do the work. The thing as an evaluator that disappointed me more than anything in the world was when someone would take the test just so they could add this to their dog's resume and had never had any intention of visiting. Takes up people's time.
Wow.
Yes. I mean,
you didn't see a lot of that, though, did you?
No.
Or more than you wanted to.
Well, in my case, I only saw, to my knowledge, I've only had one person do that. But of course, I've heard from other people, other evaluators of breeders who are trying to enhance the value of, usually it's their bitch, and for breeding purposes, that she is as a therapy dog. Well, that means she passed the test, but they never actually did anything beyond that. And that is that's immoral in my opinion.
I had no idea that was going on. What a mind opener. I learned so much when I talked to you. Woo! I learned so much. Well, this has been fabulous. Thank you so much for spending time with me talking about therapy dog work. And you've got so many other things to talk to me about, so I know I'll be coming back and setting up in your dining room again and hitting you up for another podcast. But thank you so much for being here today.
Debbie, thank you so much, and you do so much good work.
Oh, that's so sweet of you. Thank you. Mutual Admiration Society. Thank you.